We're part of a consortium, meaning there are 5 other institutions that are involved in providing services to World Trade Center responders from the tri-state area. We provide services to Long Island responders. Currently, we have a cohort of about 6,000 individuals. Long Island encompasses many square miles of area. And if you're from Long Island, you know transportation isn't too simple. So it required us to provide for geographic accessibility. So I had to identify space and locations within Nassau and Suffolk County. So currently we have 3 spaces, clinical spaces, whereby we see these 6,000 patients. We provide monitoring visits annually, and we provide treatment, both physical and mental health. So all of the challenges associated with running a clinic are my responsibility in conjunction with working naturally with Dr. Luff to make sure that the services are provided and that they're provided in a high quality, consistent manner at all 3 sites. So there's monitoring visits, there's mental health visits, there's physical treatment visits. All the challenges associated with the clinic, HIPAA compliance, are things that we have to adhere to. At the same time, this program is considered a study. So therefore, it's study on human beings, which requires you have to go through added steps to ensure that those people, their rights are protected and that they understand what their rights are. So we deal with the IRB at SUNY Stony Brook. We create consents. We have to make sure all of the consenting process is fine and that every employee undergoes training to know what the rights of human beings are when they're being studied medically. We also are responsible, as I mentioned, to provide treatment. Some treatment takes place on site. Other treatment we refer out. That means you have to enter into contracts with all of the individuals that you refer out to. So there is the contracting component, which I work with Stony Brook to generate the scope of work and secure the contract. We also function very differently than a typical clinic in the sense that we house all of the funding that's been given to us by the funding agency, and we have to approve the bills from anybody who is one of our vendors and approve them for payment and then pay them. So I oversee that aspect. Then we have the added piece of pharmaceutical coverage. All of the responders are entitled to not only treatment, but actually pharmaceutical care. Their medications, if they're for a covered World Trade Center condition and a covered med, we provide it without cost to the responder. So therefore I have to enter into a contract with what they call a PBM, a pharmaceutical provider. It's a mail order service. We have to ensure that all the prescriptions are approved and that the company is paid in a timely fashion. So that's a major challenge.